Since you mentioned the magical word Clincheck, tell me a little bit about when you do aligner cases or Invisalign cases, like on average, how many Clinchecks do you go through to get it right?
It takes me several times.
Me too.
Yeah.
Yeah.
I struggle. As soon as in the morning I wake up, look at my Clincheck, and there's always things you can find, tweak, and everything. They use the same concept, the same theories that we were taught in residency, and straight wire bracket technology as well too. Like, oh, if I do this, we're gonna have an open bite. If I do this, we're gonna make this curvous speed worse. So to answer your question, endless Clinchecks. I don't know how many, at least 5 or 10.
I know mine take a long time too. And I think there's a huge misconception, I know, with my clients who are general dentists, like they think that if they have their preferences right, that, and whether, even if they're doing like a 6 or go, they think that it should come first, like perfect the first time. And I'm like, no way, it can take me 3, 4, 5, 6, 7, and you sometimes up to 10 to get it right. You have to be patient. And sometimes it's like 2 steps forward, 1 step back. You know, like, listen, these are not doctors that are doing the click checks. These are just technicians in Costa Rica, you know, and a lot of them are fantastic. I've had some great ones and I've had some awful ones. And I think the higher up you get, sometimes you get a better one, but I don't know. I mean, I still don't get great ones sometimes. So I really recommend that if you want to learn how to optimize a Clincheck, I mean, please connect with us because we're going to be teaching the course in November. It's actually going to be every quarter. We're going to have it. There's also a whole year-long like mini residency. You can't call it that, but mini course where we'll be with you the whole year. You'll be working with your whole group, but also individual courses where you actually get to do hands-on indirect bonding, prep, tabletop straight wire. We'll be learning how to optimize Clinchecks. So much information. So we really recommend that you connect with us if you're interested in that course. So it's going to be again November 15th and 16th in Phoenix. And yeah, email us if you want to get on the wait list for that course. And its price point will be really reasonable. Perfect. So yeah.
If you want to learn ortho, I think it'd just be better to start off with indirect bonding. Like, I know it sounds kind of weird to start out indirect bonding, but I think like as a kind of how I learned the residency too. We actually have to mark, like the video you saw, we had to mark all the height of contours and marginal ridges, where the bracket placements are. By doing that, you understand tooth movements and mechanics, biomechanics, before doing it chair side.
Yeah, I completely agree. They're going to learn so much just doing it themselves the first time instead of just ordering it from somewhere.